Okay, hello everybody. This is Terry with the Premom team, and we have Brianna Kane today to talk about early pregnancy.
Hi, everyone.
I'm super excited about this because we have not touched on this area ever, as far as I know, in any videos or live. So this is the first time, and I know we're sharing live to the Premom TTC group, but Brianna made the point that you may be thinking about what to expect when you do finally get that BFP. So she's going to answer a couple of questions first that you gave her in advance. Thank you for those. And then she's going to talk a little bit about her experience with those patients that she's had. And anytime during this live broadcast, if you have any questions, she's open to answering questions live. So, Brianna is a registered nurse. Wanted to mention that, forgot. So we have some great expertise here. She's, if you saw her previous video, she talked about how she really takes a woman from the beginning of the TTC journey all the way through to the point where she's ready to give birth, right? Is that about right? You could just, you take her all the way through.
Yeah, so I definitely have some experience in that. I was a labor and delivery nurse before I moved into fertility. So I definitely have been a part of kind of patient's care, all walks. But I would say that I'm a little bit more prepared on the early pregnancy stage because working in the fertility sector, you definitely take care of patients, in that first trimester stage, a lot of times before they would normally go to their regular OBGYN. So there's a lot of things that are unique to that first trimester of pregnancy. So I'm excited to talk about it today, for sure.
It looks like we got a hello, and we do have a question about chances of pregnancy, if you want to touch on that as well.
Okay.
Notebook. Okay, I have my notebook. I remember. So the first question was about being pregnant with COVID. There was a user who mentioned she has COVID and she's, I think, 4 weeks in, and she was wondering if she should be concerned or what your general thoughts are.
Yeah. So with COVID, I mean, this is a new thing that we're having to think about. COVID has only been around for, a few months now, really this year. So it is something new that pregnant women didn't have to really think about, up until recently. So it is a really great question. I'm glad they asked it because I'm sure there's lots of people who are, concerned about it. So this person specifically is pregnant and already tested positive. She knows she has COVID and wants to know if she's worried, if she should be worried about her baby. So first and foremost with COVID, the severity, the symptoms of COVID can be a lot worse, according to the CDC, for pregnant patients as opposed to, non-pregnant women. So it's really important to just overall take really good care of yourself. If you think that you need to go to the doctor or the hospital, that you're getting really sick, just because you're pregnant or just because you have COVID does not mean you don't need to go. More so, it means that you need to seek medical treatment. So this person was saying that she has all the symptoms, so that kind of goes in line with that. So it doesn't actually mean that there's anything concerning for the baby at this point, but it does mean that she's more susceptible to have a more severe case of COVID. So it's important to take it seriously. And like I said, just, make sure the people around her know what's going on so that they can help her. And then, like I said, seek medical treatment if needed. Don't be afraid to go to the ER if you need to and that kind of thing. There has also been kind of somewhat of a correlation between women who test positive sometime in their pregnancy have kind of somewhat of a higher chance of preterm birth. But they don't know if that's actually correlated to COVID or not, because a lot of women do have preterm birth for a lot of reasons. Preterm birth would be anything before 37 weeks gestation. So they don't know if that's really necessarily because of COVID, but they are seeing that correlation right now. Again, this is early, so they're just now learning about these kinds of things. And then also some infants do test positive once they deliver, if they've had a mom that has been positive during pregnancy. With this person being 4 weeks gestation, I would assume that that probably wouldn't happen. But either way, the good news is that babies tend to handle COVID really well. They don't kind of have the same symptoms and severity of COVID like adults do. So that's the good thing, that usually it's not a big issue, and they're perfectly fine. But the main thing is just to take it seriously, for sure. And if you don't have COVID, but you're worried about COVID in pregnancy, you should be, obviously, but that doesn't mean that you shouldn't go to your OB appointments. It doesn't mean that you shouldn't go to the doctor. All of those things should continue on in pregnancy to help make sure that you and the baby stay safe throughout the whole time.
Okay, good to know. And I know the other question was about exercise. And this user had said that she does Pilates, she walks, she does yoga, stretching. Like, man, I need to get on your regimen. So she's wondering what's safe in early pregnancy.
Yeah, so that's a really common question that I get. A rule of thumb is that if you have whatever exercise you were doing before pregnancy, you can continue on in pregnancy. So if you even ran 5-6 miles a day, you can continue that on in pregnancy. That's okay, as long as you are already used to it. Now, someone like me that doesn't run at all, if I got pregnant and decided to run 6 miles, I might die. But someone who's used to that, it's perfectly normal. The key thing, though, is that you never want to push yourself and make yourself cause yourself any discomfort or pain. So right now would be not the time, pregnant, to try anything really strenuous or new and crazy that's going to cause you a lot of pain and discomfort. You don't want to push yourself in pregnancy. So exercise is great. We want you to exercise. It actually can help with your energy through pregnancy, and just, your overall mental health in pregnancy. You're dealing with a lot of hormones, a lot of changes in your body. So exercise is great, and we want you to exercise. You just don't want to try anything new and do anything strenuous. A common thing that women in pregnancy have is round ligament pain. As the uterus begins to stretch, you get these kind of really sharp, they can be really sharp pains, almost feel like stabbing in the groin area. And that's very common. And so just with stretching and that kind of thing, you may notice some of that. So again, just not pushing it too far, and just kind of taking it easier than you normally would. Again, that doesn't mean that if you are a runner, that you have to stop running or, that kind of thing. You just don't want to do anything to push yourself. And if you're really concerned, I would, about exercise, no matter, after this conversation, I would just say, make sure that you confirm that the pregnancy is safely inside the uterus. And, everything's good at the doctor at your first, confirming doctor's appointment, before maybe going back to your regular exercise regime. But overall, generally, you're not going to cause any harm to yourself or to the baby if you're doing what you kind of have always done and you're not pushing yourself to the limit.
Okay, great.
Yeah.
All right. Let's throw in a couple questions because we have a bunch. Some of these are more TTC related, so we might save that for the very end or for another time. But we have a couple. Someone asked, is it possible to be pregnant and have low HCG?
Yeah, absolutely. So, so there's no rhyme necessarily to this is the level that you have to have your HCG at a certain point. So when you go to a doctor, they may say that this is the range that we're looking for based off of how far you're supposed to be. But every woman is completely different in how their HCG rises. So when you get a positive pregnancy test, it's testing that HCG in your body, and that level will rise differently than the next person. So it is very possible to have a low HCG. HCG is only present when you're pregnant. So if you have HCG there and it's testing a pregnancy test or a blood test or whatever it's testing, you're pregnant. It's just, that measures early in pregnancy. The HCG is measured to kind of help us give an idea of how the pregnancy is developing prior to an ultrasound, being able to test an ultrasound. So you can't see really the baby on ultrasound before 6 weeks gestation. So before that time, especially like when you're doing fertility treatments and that kind of thing, doctors will track your pregnancy with rising HCG levels. So it just depends on kind of what that person's story is. If they had a really elevated HCG and then it started to lower, well, that's not a good sign. But just a certain level saying whether you're pregnant or not it's not efficient information. So really, like I said, you can't say that there is one HCG level that's going to tell you that your pregnancy is safe. It's really how it's rising is what tells us if the pregnancy is developing appropriately. But again, these are just right now kind of clues when you're early in pregnancy before you can get an ultrasound. Once you get an ultrasound, that is the determining, that confirms the pregnancy. So even though, you may have a blood test that says you're pregnant, you may have a urine test that say you're pregnant, really confirming the pregnancy is actually witnessing, the gestational sac and, the baby inside of the uterus, safely inside of the uterus. That's what 100% confirms it. So it doesn't mean that you're not pregnant if you get a positive, but in order to confirm it and absolutely say 100% that you're pregnant, it would be through an ultrasound.
That's helpful. Thank you. Let's see. We had someone talk about getting cramps when they're 7 days past ovulation, 7 DPO. Can you talk to bloating and potential early pregnancy or bloating during early pregnancy?
Yeah, so I mean, really the best indicator for pregnancy is a positive pregnancy test early on. So a lot of people get symptoms like, nausea, bloating, nipple tenderness, swelling in their breast, kind of, enlarged breast. There's a lot of different things that go along with early pregnancy, but they also, unfortunately, can be signs of right before you get your period too. So that's why they say really most of the time, symptoms are not going to be the thing that's really going to be a telltale sign for you. It's waiting until your missed period and taking a pregnancy test. But some of those symptoms, are common in really early pregnancy, but unfortunately, like I said, they also can be common and can be associated with a period. So, and the best way to just know for sure if you're expecting or not is to wait until you get that period, or wait until you should have that period and take a pregnancy test.
Okay, great. We did have a couple questions about BBT. They're more about TTC, but I just wanted to answer one that it's best to take your temperature first thing in the morning, same time every day before you get out of bed. That's the best time because it is your basal body temperature. Let's talk about early pregnancy and BBT, like what to look for, because that is another symptom, right, that you can track to track your pregnancy for a while. Can you talk about that?
Yeah, I don't know much about that because in early pregnancy, my background is really in fertility, so in fertility treatment. So, the thing about it is that is a little questionable in your time frame. Your temperature does increase a little bit in pregnancy, but again, like that doesn't really tell us anything that's going on, with the development of the fetus and that kind of thing in the pregnancy. So it's more important that may give you some clues and some indicators, but that may be a reason to say, hey, I need to take a pregnancy test, and find out. And then not be concerned if you really think, if you're having symptoms, if you have that increased temperature and that kind of thing, not being concerned if you don't get a positive pregnancy test right when your expected period is supposed to happen. Sometimes, like we talked about with the HCG levels, everybody's HCG level rises a little differently. So I've definitely known people to get a positive 1 or 2 days before their expected period. And then I've seen people, it takes a week after their expected period to show up on a pregnancy test. And like you talked about with the basal body temperature, it also depends, like when you take a pregnancy test, it depends on, when you're taking it during the day. Have you, held your bladder long enough to have enough of the hormone in the urine that you're testing it on, and that kind of thing. So it is somewhat common that, pregnancy tests nowadays are really good. They do pick up pretty early on. But sometimes, like I said, every woman is differently, is structured differently in how their HCG rises. So it wouldn't be abnormal if, it would take a couple of more days for someone to get a positive pregnancy test. That doesn't mean that anything's wrong. It just, it could be just error from taking the test, but it also could be just how that HCG is rising, perfectly normal. So, yeah. And I think that, I'm glad that we're going live in the Trying to Conceive, Facebook page, because, people a lot of times associate like, oh, this is something that I just have to worry about when I get pregnant. But when you're trying to conceive, these are things that we're talking about. We're going to talk a little bit more about that you need to think about while you're trying to conceive, because most people don't find out they're pregnant until they're about 4 weeks gestation. And already a lot has happened developmentally at that point. So it's important for us to do our part and treat our body well, so that a pregnancy can occur and safely develop the way that it should at that time. So, yeah.
Okay. We had a question, let's just tweak it a little bit, about how to increase your, let's see, where was it? Your chance of pregnancy, but let's increase that to keeping your pregnancy and early pregnancy. So what are some to-dos and not to-dos in TTC and leading into early pregnancy?
Yeah, absolutely. So when you're trying to conceive, you kind of want to act like a pregnant patient, okay? Like a pregnant woman. So how to do that is really to kind of cut back on caffeine consumption. I'm going to list them kind of quickly and we can go into it, but no drinking, no smoking, continuing exercise, maintaining a healthy diet, eating continuously. So like not going long stretches of time without eating. Those kinds of things are important to kind of, just be healthy. Taking a prenatal vitamin with folic acid or along with folic acid. So some people, you can buy folic acid by itself. You can take a prenatal vitamin with or without the folic acid and then add the folic acid. So just kind of maintaining a safe environment in your body and being an overall generally healthy person. So caffeine is a big thing because we are caffeine driven in this country. So many people are addicted to soda drinks and, coffee and lattes and that kind of thing. So caffeine is not something that you have to completely eliminate out of your body. You are allotted to have about 200 milligrams of caffeine a day, which ends up being about like one tall drink or like 2 shots of espresso or 2 small cups of coffee, around there. The reason why that's important is because caffeine, too much of it, can actually cause blocking of iron absorption, which can lead to anemia. And then it's a diuretic as well. So it can decrease the calcium in your body. And basically whatever you're getting, your baby is getting. So a lot of caffeine, the baby's going to get a lot of caffeine and be a little hyperactive and that kind of thing. And not get the rest that it needs potentially too. What's important, instead of going so crazy on the caffeine. So like I said, I drank caffeine through my whole pregnancy. So we owned a coffee shop at that time. So it was, it was a struggle. But I had 1 latte a day. My baby's fine. Okay. So it's perfectly fine. You just don't want to, I know lots of women, I've taken care of lots and lots of women that literally all they do is drink soda every single day. They don't drink water, that's all they drink. That's not healthy for the pregnancy. So there are some things that you can do in place of that. Obviously you can drink caffeine, but keep it to a minimum, about 200 milligrams. And then also having those snacks throughout the day, healthy snacks like an apple is really good energizer. People say that, an apple is kind of comparative to the same energy you get in a cup of coffee. I don't know if I completely believe that, but it's helpful. But I'm coffee. I like coffee. So, and so, just taking some snacks, keeping yourself energized with food, right? So that's helpful. Drinking lots of water is helpful. Taking naps, if you're tired, just not constantly being on go is helpful in place of that. Drinking and smoking are definitely a no. So even when you're trying to get pregnant, it's kind of important. Smoking definitely is very important. The drinking, it could be minimal, but at the same time, like I said, like you could be pregnant and not know it till about 4 weeks gestation, when a lot of development has happened, specifically in the brain and the heart. There's a lot of organ development going on in those early stages. So it's important to kind of think of yourself as being pregnant. Smoking and drinking, there's a lot of things that can come from that. Low birth weight, early preterm delivery, with smoking, chances of asthma, respiratory disease, food allergies, chances of ADHD in that baby is increased drastically. So it's really important to kind of, like I said, just think of yourself as a pregnant person. And then diet, once you do get pregnant, so this is not really an issue until you do know that you're pregnant. Early in pregnancy, your progesterone is what supports the pregnancy. Once you develop your placenta, everything basically is everything that you get, the baby gets once all of that takes place. So until the progesterone kind of stops taking care of the pregnancy, once that happens, it's really about 8 to 10 weeks gestation. So it's early in pregnancy. At that point, everything that you're feeding yourself, your baby is getting. So everything you put in your body, your baby is getting. So when you do get pregnant, when you do find out you're pregnant and you confirm pregnancy, it's said that you need about 300 extra calories a day, which is not a lot. People assume that when you're pregnant, you can eat a ton extra. 300 calories is nothing, it's really not a whole lot. So thinking about that doesn't give you the excuse to eat for two, unfortunately. I know that's a common thing, but that excuse is out the window, unfortunately. But some things to not eat would be, raw fish or barely cooked fish. That's not okay. Cold cuts, deli meat, hot dogs, like unpasteurized milk or cheeses made from unpasteurized milk because of the risk of listeria. So those are kind of like the main things that you can't eat. But yeah, overall, just like I said, trying to be a healthy individual and thinking of yourself as pregnant and kind of keeping down that caffeine consumption, no drinking, no smoking, those kinds of things, and making sure that you're exercising and eating well to kind of support your health during that time is going to go a long way with trying to get pregnant. And then once you do get pregnant, because like I said, if you don't know that you're pregnant, we all want obviously a healthy baby. But if you don't know that you're pregnant, then, you can't really do a whole lot about it. So that's why thinking about these things ahead of time is going to be beneficial for your pregnancy as a whole.
I have a follow-up question myself to that. So You talked about early pregnancy and also TTC leading up to pregnancy. So some of those diet restrictions that you gave as far as like processed meats and things like that, do you recommend that while they're TTC that they avoid those foods as well? No.
Yeah, so that's the only thing. The diet is the only thing that you don't really have to worry about until you confirm pregnancy. Because like I said, it's not until the placenta is formed that the baby is really getting everything that the mom is getting. So, early on, all of that stuff is still kind of developing. So you don't have to worry about the diet restrictions until you actually confirm pregnancy, but it does start pretty early. It's about 8 weeks gestation that you would be thinking about those kinds of things. So the diet restrictions are the only thing that you don't have to worry about, but the caffeine consumption, the smoking, the drinking, those kinds of things are a good practice. I know lots of physicians and nurses that say, drinking's okay in early pregnancy. Of course, like we know that there's lots of situations where women have not known that they were pregnant and they drank, a couple of times or whatever throughout the week and had a perfectly healthy baby. That's not a strict, thing, but we do know 100% that drinking is not healthy in actual pregnancy. So we know that, farther on into pregnancy that it can cause a lot of issues. So my thought process is really, why would you want to take the risk when we really don't know? There's not enough to really determine. Just like with, smoking marijuana, for instance, is a hot topic. We don't know exactly. There's not enough studies that can really determine the effects of marijuana on infants. When it's being used during pregnancy. And that's because most women, they have stated associated with smoking marijuana are also doing other things like drinking and that kind of thing. So they can't determine what is the deciding factor. Is it really the marijuana? Is it the drinking? So there's a lot of unknowns in that. And again, if you're trying really hard to get pregnant, you just don't want to risk it. So my thought process would be just don't risk it at all. But probably on the flip side of that, a couple of drinks here and there, 3 drinks a week or whatever, wouldn't probably be an issue while you're trying to get pregnant. But as soon as you think that you could be pregnant, then you definitely want to stop for sure.
Okay. And then we had a question, I think someone answered for us, but you said 8 to 10 weeks is when the placenta develops. Is that about right?
Mm-hmm.
Great.
Yep. Yeah. And sometimes it can take a little bit longer. It depends, but on average, it's about 8 to 10 weeks gestation. Mm-hmm.
Okay. Let's see. Can you touch on the stress and ovulation and early pregnancy?
Yeah. So stress is, a big thing. I'm looking at it from kind of a fertility background, but I've had a lot of patients that have tried to get pregnant, and going through this process, whether you do fertility treatments or try to get pregnant on your own, it can be very stressful. It's a very stressful process. And then on top of that, we Americans are stressed to the max. That's normal. We go. We don't leave time for rest. We do more than we should because we think we're not doing enough, so that's very common. So with stress, it definitely, I am a huge proponent of stress can cause a lot of issues with achieving pregnancy. There have been, like I said, so many patients that have done fertility treatments, every fertility treatment under the sun, but they've been so stressed out about the process. And I usually recommend those patients to take some time, take a break. And if I'm talking to someone who has been trying to get pregnant on their own, however it is, tracking, that can be exhausting. Taking ovulation predictor kits, taking pregnancy tests, that can be exhausting mentally. And so sometimes it's perfectly fine. It's not going to hinder your chances of success. I think it will help it. It's perfectly fine sometimes to just take a break and just be you and not worry about getting pregnant. That can do so much. And I have had so many patients in the past that have done that. And that with with big fertility treatments like IVF and that kind of thing, they've taken a month, or two, taken the holidays, to just relax and not worry about achieving pregnancy or not. And then they get pregnant. And I think it's a huge correlation with just getting your mind in touch with your body. When your mind is at rest, when you're less stressed, your body really can kind of function the way that it's supposed to, can do what it needs to do. Now, of course, there's obviously a lot of people who have underlying things that have to be addressed, you know, from a physician standpoint, or, you know, from some kind of medical care. But overall, you know, stress is a huge thing. You know, so like I said, if taking a break, if you are one of those people that have been so mentally bogged down by this process, and it's so upsetting every time, you know, you get the period, you get the negative pregnancy test. I've been there. I know how it feels. And sometimes it is just so good to get a mental break and not worry about it for a little bit. And then you can come back refreshed. As far as stress goes, though, too, like just with this fertility treatments and that kind of thing, doing what you need to do to help you relax through this process is going to be super beneficial. Like we talked about before, exercise is a great way to relieve stress. It's very healthy for us. It's really healthy for our bodies. So that's a good thing to do. Taking naps, you know, sleeping is a good way to relieve stress. It's a really good way to relieve stress. So if you need to take a break and you need to take a nap on your lunch hour or whatever, do it. And then also, you know, whatever it is that brings a little bit of peace in your life is going to be super beneficial for your pregnancy, for trying to conceive. I know people who, for me, like, you know, rewarding myself with a massage once a month or every other month or something like that was a huge thing for me. I know people who get really relaxed with acupuncture, you know, going to see a therapist, talking with a therapist. There's a lot of things that you can do that may just bring you a little bit of joy, you know, and help you kind of relieve some of that stress. Not trying to do this all alone. We as women, whether it's, you know, whoever's issue it is, whether it's, you know, the female partner, the male partner, whatever, women, because it's our body doing the job, we have a tendency to take it all upon ourselves, that it's all our fault, and take the weight of the whole issue. And so not trying to do this alone, do it as a team, even if you're, you know, a single partner trying to achieve pregnancy, whatever it is, you know, using the people around you, your friends, your family, to kind of help you in this process and not go it alone is going to be a huge stress relief. You know, sometimes it can be a stressor too. You got to pick the right people. So, you know, be careful with that, but just not going at it alone. I know personally, my own situation, I was going through fertility treatments, but before that, 4 years of tracking my cycles and that kind of thing. And I barely talked to my husband about it because I don't know why. Honestly, it just was an internal thing. I thought if I spoke it out into the open, if I spoke it into existence, then, you know, it really was a struggle. But looking back on it, I really should have talked to him more, let him be a partner to me during this process. And I think that would have helped with my stress as well. So yeah, I mean, doing whatever you need to do to make yourself, you know, less stressed. Some people, you know, that means going and crafting for an hour or reading a book or, you know, going and getting a coffee or something like that. It will look different to everyone, but whatever it is, it's important and it can be super vital to your success for sure.
Okay. And I think I want to see if we can squeeze in 3 more questions here. And I see we do have some other questions, again, that are related to TTC. So we're probably not going to touch on those. I'm trying to kind of tweak some of them, but please ask again in a future panel or live session. Just watch for the different topics. We try to have new topics for you every week. And we may have covered some of these questions as well in our other videos. So please take a look. I wanted to start with... someone had a question about prolactin. Is that something that might be an issue in early pregnancy?
No, I mean, no, not really. I mean, it would be super specific. Yeah, it would be super specific. So. Okay.
So we'll come back another time with that one. Let's see. We had a question about can you touch on miscarriage a little bit in early pregnancy, and then also just trying to conceive again after miscarriage?
Yeah, absolutely. So miscarriage is kind of a definitely a big topic, especially in early pregnancy. So you have about a 10 to 15% chance of miscarriage in the first trimester of pregnancy. Okay. So in some ways that doesn't seem like a lot, but in other ways it really does seem like a lot especially when you're trying so hard to get pregnant. So once you do get pregnant, there is that chance of 10 to 15% chance of miscarriage. When you get to your second trimester, that drops significantly to a 1 to 5% chance. So as you can see, in that first trimester is where, the bulk of the concern is. The major thing to think about is that living a healthy lifestyle and treating yourself well during pregnancy is important. But most miscarriages, and that is for the health of the baby, that's not to prevent miscarriage. Most miscarriages happen whether we want them to, and there's really no way to control it. There's no way to stop it. Most of the time it's because, and I think I've touched on this a couple of times in previous videos, but most of the time it's because the embryo that was developed was not normal and decided not to attach to the uterus. So there are kind of two different possibilities. It didn't attach to the uterus, which there are some reasons that could be, but most of the time it's because it was an abnormal embryo could lead to an abnormal pregnancy. So it's our body's way of kind of protecting ourselves from having an abnormal pregnancy or something that could be dangerous to our life and that kind of thing. So it's important to know that it is common, unfortunately, but it doesn't really correlate with your ability to get pregnant the next time. So you have a really great chance of pregnancy again. More than likely, it's just that embryo that was created was abnormal, and that's okay. You've got to understand that, we as females, we have, all the eggs that we're ever going to have when we're born. So however old you are is how old your eggs are. Doesn't mean that anything's wrong with them, but when they meet with the sperm and create an embryo, sometimes they just don't function the way that they're supposed to, and that's okay. And that can lead to an abnormal pregnancy, which would result in a miscarriage. So even though it's an emotional situation, it's not fun to go through. Again, it's our body's way of protecting us, but again, does not mean that you're not going to be able to get pregnant. Women have a great chance of pregnancy after miscarriage, and it's not super common to have recurrent miscarriages either. The older you get, that does increase. So over the age of 40, recurrent miscarriages are much more common. But again, that's because we have less and less eggs to work with. So it's, I kind of relate this to, I always get the question of like, should I announce my pregnancy early? And so that's kind of a hot topic with that. And my thought process is whatever is going to be, obviously it's very dependent on who you are, how you handle this kind of stress and this kind of emotional situation. But like I said, once you get into the second trimester, which is after 12 weeks gestation, your chance of miscarriage decreases drastically. And really in that first trimester, as you go along in your pregnancy, it gets lower and lower. So I said a 10 to 15% chance in your first trimester, but actually as you get farther along, 8, 9, 10, 11, 12 weeks, that decreases, that continues to decrease into that, like what I said in the second trimester, to that 1 to 5% chance. So it's again, like it's just a really emotional situation. So again, there's not much that you can do to prevent a miscarriage if a miscarriage were to happen, because most of the time it's something that we can't control. It's how the embryo is developing, what's happening on the inside. But what we can do is make sure that its home is nice and wonderful and amazing, to stay there for 9 months. And do our part to make sure that it's a good environment for a pregnancy. So kind of doing our part. And like I said, some of the things that we talked about, the exercise, the eating right, the, no smoking, no drinking, that's to make sure that the longevity of the pregnancy is healthy. But that doesn't necessarily, doing those things doesn't mean that 100% you're not going to have a miscarriage. Unfortunately, it's a common thing. that happens way more than we even know. I think I touched on this last time, but miscarriage happens so even probably more than that, because, about the time that a miscarriage would happen, you would expect your period. And so you think that the bleeding from a miscarriage is actually, a pregnancy. So women probably have more miscarriages than we know. And unfortunately, it's a common thing. It's just something that we have to deal with. But knowing that there is so much hope after a miscarriage is important. So it's a hard thing to go through. It doesn't mean that you're going to have issues getting pregnant again. It doesn't mean that you're going to have fertility issues or anything like that, or that anything is wrong with how your body functions. It just happened. And, you're very likely to get pregnant with a normal pregnancy that goes to full term, and there'll be no issues the very next time.
Okay. I think you may have touched on this last one. I just want to make sure. Someone asked, what week would be a milestone point in the pregnancy for a viable pregnancy?
Oh, so are we talking like late? A viable pregnancy is about 24 weeks gestation.
Okay.
So yeah, so that's a little later, but yeah, so that is the term deemed kind of viability, as far as that, we can safely take care of a baby outside of the womb at that time. It really, though, if we were getting technical, it really depends on the size of the baby. So there have definitely been 22-week babies that have been deemed viable when they come out of the womb, if they were to be preterm delivered for whatever reason, because their size. So if they're a little bit bigger, and then on the vice versa, if there's a 24-week baby that's really, really, really small, significantly underdeveloped, then, they may not survive as well. But 24 weeks is really where we say, we can definitely take care of them outside of the womb, but they have a long road. So in the, babies born that early have a very, a roller coaster of a ride. There'll be days where they're, doing really well, days where they're not doing really well, and they have to stay in the NICU until really their full term. So, and sometimes longer. So it's a long road, but it definitely, that is the time where you can, kind of breathe a sigh of relief and know that, your baby would be able to be taken care of outside of the womb. But, like I said, it's not a for sure as far as whether the baby would survive or not. It just means they're definitely given a really good chance to fight for it, for sure.
Okay, thank you. Yeah. And I know we had more questions. A lot of them were TTC related. I highly recommend the miscarriage panel that we had recently. We also had one on unexplained fertility that I think may address some of those questions. So please make sure to check those out. And if you feel like your questions still need to be answered, please let us know, because we are going to continue to have these panels and these spotlights. That's the plan. Some of them live. So we want to know what you're interested in, and we want to address the topics that you need assistance with. So thank you for participating today. And Brianna, do you have anything you want to leave us with? Maybe anything that we didn't touch on you just want to end with today?
Yeah, I'm trying to think. I wrote down just kind of some things that are common. I mean, I think how to confirm if you're pregnant or not. That's kind of, like we touched on that a little bit, but, taking a pregnancy test when you expect a period. And then when you get a positive pregnancy test, calling your OB to make an appointment. Usually, and it's important to know that, even if you get a pregnancy test first, right away at 4 weeks gestation, you usually don't have an appointment with your doctor until about 6 to 8 weeks gestation. And then you probably don't have your first ultrasound until you're closer to 10 to 12 weeks gestation. So that's just kind of something to think about. Just it's just kind of important to think about what's your plan when you do get pregnant, because I know specifically, even though I'm an RN and in OB care and, all of that, I was so focused on getting pregnant for 7 years that when I got pregnant, I was like, oh crap, what do I do?
Now what?
Yeah, now what? So it's important to think about those kinds of things, like where you would be going to get your care and that kind of thing. What do you want your birthing experience to be like? Because that's important to think about actually now, even when you're trying to get pregnant, because really determining who you go to for care will determine what your birthing experience is going to be like. So if you want to, you want to have a midwife, you want a home delivery, or you want to be in a hospital, or you want to be in a birthing center or whatever, or you want to deliver at this specific hospital, you would have to go to specific doctors to deliver at that hospital. So it's important to think about those things so that when you do get pregnant, you know who to call immediately and you can get in as soon as possible, so that you can start early prenatal care. Prenatal care is key to having a healthy delivery, a healthy baby, being healthy during pregnancy. So it's important to kind of think of those things ahead of time. So I think that's the only thing that we didn't reach, that I just kind of thought of some common things, but it's important to plan ahead. I was telling you, Terry, before we started this, that I feel like some people think it's like bad luck to worry about pregnancy until you get pregnant, because it's like, oh, well, now I'm not going to get pregnant if I think about it, too early. But it's actually key to your success to get pregnant, to think about what life is going to be like afterwards, to make sure that you have a healthy environment for that baby to stay and, develop long term. So it's important to think about these things ahead of time and think about what your plan will be. Like I said, you don't have to get specific in it. You don't have to, have it all written down and ready to go, but it is good to have a plan in place and know what will happen when you do get that positive, so that you're not scared and concerned, because that leads to stress. And like we talked about before, we don't want more stress. We don't want freaking out. We want you to feel happy about what's happened. And that's a really fun time, early pregnancy, and to know that you achieved what you've been trying so hard to get. And so the key to making sure that you're happy in that time frame and, and enjoying that time frame is being prepared. So that's what this is kind of all about, is just making sure that you're prepared.
Okay. Great. Well, thank you so much, Brianna. And thank you, those of you watching, again, for fantastic participation. This was a great live. Yeah. And again, please keep those questions coming. We intend to have future videos, so let us know what you want us to talk about. Please check out the ones that we've already done, and we've been adding them now to the Facebook group, so watch for those to pop up in our units. And you can find Brianna as well as our other virtual consultants right within your Premom app. If you go to more and schedule a consultation, they're right there. So please be sure to check those out as well. You can find Brianna right there. And I look forward to seeing you again soon. Maybe we'll even, like we talked about, go live in the pregnancy group once, because I think this is really important content for both. Yeah. So I'm really glad that you were on today.
Yay. I had so much fun. Thanks, Terry. And thanks everyone for watching. I appreciate it.
You're welcome. Have a great rest of your day.
Thanks. Bye.
Bye, everyone.